of course, that's probably you've been at it for 37 years, a lot of pinch hitting in 37 years, right? Okay, all right. We didn't talk about one thing that tickled my interest when, not enough times for questions, obviously, but if we're parking questions somewhere, I think one of the ones that we need to park is, particularly, sir, in rural areas, the notion that Heidi explored about having medical services provided to the individuals at the home base rather than in another base is somewhere that I think we need to further look at that and explore it. I know that many medical centers are doing that with distance services, whether it's through the internet or whatever, but we now know that it's harder for particularly the elderly, I'll count myself as one of them, engage in that technology. So we've laid some of the issues out in front of us to talk about for the rest of the time, but I think now it's important to do one of the things that Heidi's research showed, which is, and Oscar, which is you learn best from your peers, right? And peer-to-peer learning is where we really, there's transferability of information. So to start that off, we have our first panel, which is going to look at examples of cross-sector collaboration in providing transportation services to medical in urban settings. And I'm going to ask Nigel Wilson, my colleague in the Planning Committee, to come up here and take the podium from me. And if the first panel could please come up, I would appreciate it.
Yeah, if the panelists for this panel can come up, and the discussants also can sit in the front row here, that would be great. Thank you so much. Okay, she's supposed to be joining us, okay. As the panel is getting seated here, I'd like to thank, first of all, Alina and Steve for inviting me to be part of the planning committee. It's been a great learning experience for me. It's been really, really something. I've been focused very much on the transport side, so learning more about the healthcare needs and how to combine these, as Art was saying, is a critical thing that's been really, really interesting for me. I'll say a few words about me. I'm Professor of Civil Environmental Engineering at MIT. I can go Art a few years better. I arrived at MIT 51 years ago this coming September, and what really got me involved in transport, where I've spent my life since then, was a graduate course on the future of urban transportation, which I took exactly 50 years ago. It just about finished 50 years ago today. And some ideas came out of that, which were the precursors to demand-responsive transit. We came up with initial ideas on dial-a-ride demand-responsive transit, which led to ADA paratransit eventually, many years later. Bus-only streets, which can trace directly into bus rapid transit, as a concept that's very important now in public transportation. And the third concept that came out of that, which has been morphed considerably since then, was personal rapid transit, which is now autonomous vehicles. And so it's very interesting for me, being involved in this workshop and the planning that went into it, to sort of complete the cycle of activities that I've been involved in one way or another over the last 50 years. It's great to see Bruce and Art and Barry as well, who I've had the chance to interact with in various times over this period. Okay, as Isela said, this panel we're getting into more depth in terms of examples of how healthcare and transport can be combined to deal with the problems that we've already been hearing a lot about in the urban areas. This afternoon we'll get into smaller urban areas and rural areas, but today at this session the focus is on urban areas. And of course, in those areas, public transport traditionally plays a very significant role and is a very important part of the solution, but may not be the entire solution. And I think it'll be very interesting to hear what the examples are that we have from from the panelists here. The first speaker on the list was oh, great! Just in time planning. Scott Saron, who's listed in your program as a speaker in this panel, was unable to join us, but we're delighted to have Anne Lundy, who's the Vice President of Medicaid Clinical Operations in Government Programs for Healthcare Service Corporation. Anne, who is joining us via WebEx, and we just have confirmed that she's on now, will offer this perspective of a major health insurer, HCSC, the parent company of Blue Cross and Blue Shield of Illinois, Montana, New Mexico, Oklahoma, and Texas. So Anne, can we turn to you?